Horse breeding and the many assisted reproductive techniques that are improving on a continuous basis around the world grows and expands constantly, and ProBreed would like to achieve the same kind of exposure and knowledge here in South Africa. So to help us achieve that mutual ambition of developing this part of the equine industry in our country, ProBreed looks to the equivalent in Europe and elsewhere in the world to help us achieve that. And as part of this week, we're delving into this fascinating industry with their next international specialist, Dr. Anna Grabowska, ahead of her exciting visit to South Africa for the ProBreed seminars. Anna holds a PhD in equine veterinary reproduction and embryo freezing and is based in Poland. So Anna, thank you very much for dialing in and joining us from across the world.
Thank you very much for the invitation. I'm really hope for it and cannot wait.
Well, we're really looking forward to having you here, and we will have some details for everybody at the end of the podcast about how you can join Anna's seminars. Anna, you are, first of all, I was astonished and horrified at how young you are. And I don't want to shoot my mouth off here, but I believe you're 36 years old and already so accomplished in your field. What's inspired you to focus on this specific field?
I was a typical horse, and I pretty also loved foals and breeding mares. And maybe because both of my parents were also vet, that was easier choice for me to go to veterinary school. But I always wanted to be close to the breeding. That's why I decided for reproduction part. And when I was at third year of my studies, I went for the practical experiments, and I was in Neustadt and I saw for the first time embryo transfer there, and it was something new, very exciting and magical, and I thought, this is it, I just want to do it. The problem was that nobody in Poland did it before, so I had to go to Vienna to do my PhD there and to get to know and learn about these techniques more. And then I started apply it here in Poland.
That's incredible. And how long have you been doing this for now?
It's almost 15 years now. Jeez, and it's so funny because this year the foal from embryo transfer was born, and the grandmother of the foal was my first embryo transfer mare. So it's like
incredible.
Congratulations. Yeah.
Congratulations. That's quite a milestone and like a legacy.
Yeah. It's an incredible feeling.
Anna, what are the key factors that breeders should be considering when they're selecting horses for breeding projects?
Yeah, it depends if you are buying or thinking about young mares or older mares. Of course, this older mares, older breeding mares, which already got very good progeny, are more valuable. But you can think of some also problems to get her pregnant again. So I think very crucial is do a right exam. Not only ultrasound of the uterus or something, but also to look at her external conformation from the reproductive point of view. And very, very important is her breeding history. So if she got a foal every season, if they use a fresh semen or frozen semen, and if there were any troubles with during labor, this is also very, very important. So the breeding history, I think, is crucial here.
And I mean, obviously, there's things you're going to be looking at specifically in a breeding horse, and then specifically in your surrogates. So the
there's some other things you are looking at, and with the recipient mares, you need to be very strict, because you have usually just one trial, one embryo to put in. So we are very strict according to recipients mares.
And what are some of those criteria, Anna?
For sure, age. It's not like we say
what's the fine line for age?
Yeah, it's 3 to 10. Usually, but I have breeders which used mares were 16, and it was okay. But it's a matter of risk. we say that the younger the mare is, the less risk we have.
Absolutely. Okay. And how do you evaluate a horse's suit? What would you advise breeders beyond that? In South Africa, when we're selecting mares for breeding programs, sometimes, unfortunately, it can become a bit of a sentimental exercise. What are your big markers? So I know, for example, in the Hanover Verband, they prioritize conformation, temperament, movement. What for you specifically do you think breeders need to be focusing on?
I'm always thinking about what the mare had, if the mare had foals before, if the foals are better than the mare. So
Nice.
this is my main point. If I could give advice to the breeders, if they can see that the foals are improving, they are better than the mother, then even they don't have good pedigree or not very good conformation. But if the foal is straight, it's not a problem for me.
That's great. I think you speak to an important thing, that we've got to be constantly improving. And if we're not doing that, we've got to evaluate and re-trajectorize everything pretty quickly.
Exactly.
So artificial insemination and embryo transfer are becoming increasingly common techniques. Would you mind walking us through the processes and the benefits that these have for breeders?
Yeah, as for artificial insemination, this is a very good thing for the owners of the mares, but also for the owners of the stallions. So you can use semen of the stallion all over the country or all over the world, and you don't have to drive with the mare. So shipping of the semen is beneficial and very allowed breeder to use wide range of stallions. And this is safe, very safe. It's safe for the mare and it's safe for the stallion. Not only about injury that the mare can kick the stallion or opposite, but also because of the contamination which stallion can bring to mare before he got some not really clean mare. So these are the two major things. And I think that this is the good way for the breeders to improve also their breeding program. And as for the embryo transfer, this is really good thing if you have a sport mare.
Absolutely. I mean, it's just changing so much.
Yeah.
Great.
You saw I was just smiling when I started talking about it.
Yeah.
It's so you can use your sport mare for the breeding in the same time. And this is just awesome, because normally you need to take out the mare from the sport for a year and a half, and going back with a good condition to start going some sport again, it's another time. So with embryo transfer, you can have just one. I think one will be enough, or 2 per season. You don't have to need 10 in 1 year, but just one. When you have a good mare, sport mare, and she's doing really good, it's also very nice to check her as a mother.
Yes. What she produces.
Not waiting till the end of her career when she's 16 or 17. And we can, with normal insemination, you can have 2 or 3 foals. But if you check her before and she's getting really good results as an older mare, you already have a young horse
coming up.
Yeah, so this is not the only thing. You can also try embryo transfer with the mares. You have some troubles with carrying the pregnancy till term. This is also a good solution for this kind of things. And of course, you can have many foals in one season.
Yes,
so
I think it opens up that, as you said, that pool of really good dam lines. It makes it more accessible to us because people aren't worried about keeping them off of the competition circuit for a year.
Exactly.
So I think our stallion owners are probably very au fait with artificial insemination, collecting their horses. For a mare owner, what is the process? And just briefly, I mean, I know it's quite complicated and you have done a PhD on it. What is the process that they could expect if they wanted to A, inseminate their mare, or B, harvest an embryo from her?
So these are two things which are one after another. So for embryo transfer, you also need to inseminate the mare. So with insemination, the only thing which change is you need to examine the mare in the heat to get the right moment for insemination. So this is the one change, and the second, that the vet is putting the semen into the uterus, not the stallion. So it's just like when you can check your mare with that, or you can see that she's in the heat. You just need to check how big is the follicle, and if the uterus is have this heat edema, and then in the right time you can order the semen. I'm talking about fresh semen, and inseminate usually next day or even the same day if the stallion is not far away. So it's not a problem, I think.
And obviously then an embryo transfer becomes a much more complicated process, and we're going to assume that people have already identified one or hopefully two donor mares. And then the process of syncing them starts.
Yeah, so when we inseminate the mare for the embryo transfer, we are collecting the embryo at day 7 or 8 after ovulation. So the tricky thing in embryo transfer is that we need to synchronize the recipient mares in which we are going to put the embryos in. And the synchronization is more or less that the recipient mares has to have heat in the same time as donor mare. And we have to think about before, not at the moment of embryo transfer, but before, when we are inseminating our donor mare. And it's best to have 2 or 3 recipient mares for one donor, in case if they want ovulate or have some troubles in their uterus and so on.
Yeah, I'm sure, and I'm sure this is what you were saying early on about really good record keeping, is knowing how each mare does cycle. You know, if she's got a shorter cycle than normal, it just helps the owners to minimize that risk. What are some of the most common problems mares have, which you've dealt with during your breeding seasons?
So I think first is cycle problems, that they are not even, and we have not enough edema or some troubles with ovulations. And to be honest, there is not a big role for vet in this. I think the biggest help we can get, it's with diet, with good health of the mare, and with supplementation of the things which are needed for the breeding. So this is a thing you have to think of before breeding season, because every change in the diet, every supplementation, it needs at least 1 or 2 months to start to work. And to have good cycles, it's to think about it before.
What are some
this is the first thing. This is the cycle problems. And the second most common things is infections.
Sure.
And there are not only infections after breeding or insemination, there are also infections after labor. And it doesn't have to be a very difficult labor. It's just, can get infected. And also we have some susceptible mares, which can they are more easy to infect. And we have to diagnose this. And if we will get to it that this is this kind of mare, then it's easy to handle and really get her pregnant.
Anna, when you speak about nutritional health and supplementation, what are some, obviously foods are different around the world, but what are some of the key elements that mare owners need to consider in their horse's diet?
Many publications tells about omega-3 acids, and we use it a lot, and we can see a definitely change in the cycles. and also in stallion semen quality.
Oh, that's interesting.
Yeah,
Wow.
and
Okay.
it's proven. It's not only by theoretical papers, but also we had been working with this for I don't know 5 or 6 years now, and it's really working. You can see the difference. So for sure this, and also selenium is important for breeding, and vitamin E. So these are the three main factors that they can really influence the breeding season. But remember, you have to do it before the season.
Yeah, get ahead. It's not a one-hit wonder.
Yeah.
So horse breeding is obviously quite a complex and unpredictable process. Can you give us an example of a challenging breeding case that you've encountered?
So I have prepared some interesting clinical cases for the seminar, and the interesting one, I have a case of a stallion. It was a young stallion, 5-year-old. He already covered some mares a year and 2 years before, and they had a lot of foals without any trouble. And this season, he started with 15 mares, and none of them were pregnant. And the first, if you have 2 or 3 mares, you think it can happen, or maybe there was a problem with the mares. But with 15, you start to struggle. And we did the whole general exam of the stallion, and we did the ultrasound of the testes, and everything was good. The breeder said there was no injury. He didn't get any drugs or something. So when we collect the stallion, it turns out that he had no sperms at all in his semen, none. And we check again the testicles. They were looking quite good, no changes, no injury, no damage. And after a while, we figure out that his ampulla, so the place where the sperms are collecting, is full, is like plugged. And he could not.
That's interesting.
Yeah, it was very, very interesting case. And after some relaxants, relaxive drugs, and some massage, he starts to getting rid of this old sperms, and he started to getting mares pregnant again.
That's amazing. I want to know whose job it was to massage him, Anna, but it's fine. We won't cover that. What about so sport horse mares we discussed earlier on, and you said obviously the embryo transfers are so fantastic for them because it means they don't have to wait until their career is over. But can they easily start a breeding career once their show jumping or dressage or sport horse career is over?
Yeah, older sports mares are quite tricky. And you never know. It's like 50-50. There are some mares which are doing just fine, like any other mare, but we have mares which really struggle to get pregnant. The problem is that during age, even if the mares are not giving birth, their uterus is changing. There are some degenerative changes in the uterus, and the muscles of the uterus and the cervix are not working properly. So it can be really challenging to get this kind of mares pregnant. But it's just a case of every single mare. So I would say it's 50-50.
It's on a case-by-case basis, I'm sure.
Yeah.
So if you had a sport horse mare and you are potentially looking at breeding her towards the end of her career, would it be an idea to get a veterinary reproduction specialist such as yourself to look at the mare and maybe Caslix her if it's necessary, or to say, like, I wouldn't wait, perhaps, we might want to do an embryo transfer rather?
Usually it's when they are not giving birth every year, the conformation is not so bad. Okay. So it's more like a problem with cleaning of the uterus and drainage of the uterus. So for sure, we are just talking with the breeders and saying, we can try we can try and see how it looks. Usually after insemination, we know with which we are dealing with. Before, usually they are looking quite good and normal, but putting in them some semen, if it's a natural mating or insemination, reveals the real problems.
Okay. And I know this is just a little bit off topic, and I know that your focus is on the breeding. They're mixed feelings for a lot of people if they've got a fantastic mare to perhaps breed her as a 3-year-old before her career starts. And I think that's to your point. It maybe helps the breeders to save a bit of money, with an embryo transfer process. You get to have a foal on the ground early before you start producing her and see what she's going to do. There's an interesting, I was just reading about it, that some people feel like it could affect the mare's performance later on, that it could affect the pelvis, it can affect ligaments, things like that. What are your thoughts about that? Again, I know it's a case-by-case basis, really, but is there any long-term, side effects to a healthy pregnancy and a healthy foaling?
No, I believe there is no such a thing that it can influence her future sport career. Of course, if there's something can go wrong with the labor, but normally I think you can develop more. Some of them, they are getting stronger, bigger, like looking like older after giving birth, and I think they are developing during pregnancy. And for sure, it's more positive than negative impact. And for sure, it will be easier to get her pregnant again after finishing her career if she got a foal before.
Okay. That's interesting. I'm also glad to hear that it doesn't ruin a sport horse, because I have a 6-year-old daughter. So it's nice for me to hear that. Thank you. We've spoken a little bit about nutrition, and especially for pregnancy. What about stallions? You said stallions, do the same vitamins apply for stallions? And then to go on from that, what about lactating mares and foals?
Yeah, so about the stallions, this omega-3 and 6 acids are really crucial, because they protect the cytoplasm of the sperms, so it influence for the capability temperature changing. So for cooled semen, chilled semen, and for freezing semen, this is very, very important.
Interesting.
And the right diet for the stallions also improve the quality and motility of the semen, and of course the production of sperms, the number of sperms. And as it goes for lactating mares, there are typical more like diet than supplementary things. Of course, you need to put some calcium to bring the bone growing of the foal. So this is very crucial. And you can start it in the 3rd semester of the pregnancy. Then it have a good influence on how the foal is growing and his bones, and then also during the lactation period.
Okay, great. And then moving on to what I think is going to really get your blood up. Advances in reproductive technologies have obviously transformed the field of horse breeding. What are some of the most innovative biotechnological developments you're working on?
At the moment in Europe, in vitro fertilization is the number one subject, and it's called OPU-ICSI. So OPU is for ovum pickup, and ICSI is for intercytoplasmical sperm injection. And we can call it in vitro fertilization, but we are using the specific names because they're not equal to the in vitro fertilization we are doing in bovine or also in human. It is very specific. It's specific for horses because, horses are special always. Also
always more expensive.
Yeah, exactly. So with normal in vitro fertilization, you just need to, okay, so wait, from the start. Ovum pickup is picking up the oocytes which are in the follicle of the mare. And you are doing it in the clinic. And then those oocytes you picked up, they are the maturation of the oocytes it's in the lab, and then this fertilization is also in the lab. The only thing which differs horses and, for example, humans, is that normally you can put in the plate, a dish, one oocyte, and put 500 sperms into it, and you are waiting and until the things happened. Yeah, giving them the good culture place, so the good temperature and CO2 and so on, and they're doing it by themselves. And then you are looking for the embryo for after a few days. But with horses, it's not working. So you have to grab one. You have a special microscope, and you have to grab the oocyte and grab the sperm and put the sperm inside the oocyte. Otherwise, it's not working.
That's ridiculous. I mean, it's
That's horses.
Horses.
Yeah,
honestly.
Exactly.
And then how do you know the sperm that you're choosing is going to be the next the next Chaco bee?
This is a question. The person who works in the lab is choosing it. So
they just have to say a prayer.
And you know what is funny, that with ICSI, they said usually there's more stallions like colts born than fillies, because they always want to choose the sperm which is moving, is the fastest one. And usually the male ones are the fastest one.
Of course they are. Of course. In a rush to get everything over with. So this is this is the OPU ICSI. So this is So it's basically forced in vitro fertilization.
Yeah.
Okay, that's incredible.
They have no other chance to get an embryo from it.
That's absolutely astonishing. So obviously there's a cost factor, but this negates and then from this you would then have to get your donor mares ready.
Afterwards, the positive, the nice thing of one of the nice things of OPU ICSI method is that you can freeze the embryos.
Wow.
With a normal embryo transfer, it's not possible because, again, it's horses and they are specific. And then their embryos, which you recover normally from the mare, have a specific capsule that cannot allow this cryoprotectants to go in. So you cannot freeze them. But with in vitro embryos, they are small and they are not starting to getting this capsule yet, so you can freeze it easily. So you can keep the embryos frozen and put into recipient mare when you want. So you can also ship the embryos.
So that's one of the massive advantages to breeders, I'm sure, is that they can. And how long can you keep an embryo frozen for?
Like with the semen. There's no.
That's amazing.
Time. Yeah.
What are there any other benefits to the breeders besides having this great time advantage?
Yeah. So as I said, you can freeze the embryo. So you don't need to have a large amount of recipients. You are just waiting with the recipient is ready. Then you can thaw the embryo and put in. So you can ship the embryos also, and you can sell the embryos.
That's incredible.
Yeah. So these are big advantages. But also, what is here in Europe getting this method very popular? You can use the stallion semen, which is hard to get, which is their availability is very low. Because with OPU and ICSI, you're just using 1/10 of, not 1/10 of the straw.
That's brilliant. Yeah. So you could argue, like best case scenario, one straw could result in in 10 embryos?
Even more, because if you are using this 1/10 of the straw for the session, you can use for, I don't know, 500 oocytes. So
Amazing.
if your mare is getting oocytes collected that day, and your friend also want to inseminate, fertilizate his mare with the same stallion, they can say, okay, I will be collecting oocyte that day, so we can use this 1/10 of the straw together.
That's incredible.
Yeah, and this is
the possibilities for sport horse breeding, this just changes it so significantly, right?
Yeah, exactly.
Is it hard for the mares to take the frozen embryo, Anna?
No, I think it's equal or even better with the normal insemination, because you have time to prepare the recipient good.
That's such a great point. So you know that your recipient is absolutely perfect.
Yeah, exactly. So this season, we had like 82% of pregnant mares after frozen semen transfer. Yeah, and I really like it. You can plan it, you know.
Yes. That's a massive advantage. And as you say, you tracking these mares and knowing them so well, you know when everything's ready. And how quickly, once your mare is ready, how much time do you need to, I don't want to say defrost the embryo, but I don't know what the correct terminology is.
It depends on the laboratory, which is freezing the embryo. But usually worldwide, we are using this step freezing. So we need to make some steps with different concentration of cryopreservants. So it takes like hour and a half for thawing and transferring the embryo.
I know this is so exciting. I'm really looking forward to hearing more about this at your seminars. We
will have the whole day for that.
That's going to be great. A question from somebody. It's a big effort to get a mare pregnant, and taking care of her during the pregnancy. The birth of the foal is a delicate and exciting event. And then, of course, you get pony foals who just have them in a field and they're fine. But can you share some insights into the birthing process and any advice you have for breeders for the first minutes and days of foal care?
There's a very nice rule. It calls 1-2-3 rule. It means that during 1 hour, the foal should get up. During 2 hours, he or she should start drinking. And during 3 hours, we want the placenta go out, and you could see already meconium going out. And this is a very nice rule, easy to remember. And if something is not going in this particular time, this is you need to call your vet.
Okay.
So, and there's a lot of things the breeders can do and think of, but it's a really wide topic, and I hope we will be able during the weekend just go through it step by step.
I like the 1-2-3 rule, though. I love simple things are nice.
Yeah.
Strong relationships with breeders and horse owners is essential. How do you communicate and collaborate with them to achieve their breeding goals?
It's not easy way because we just love to talk about the stallions, which stallion we should use for this mare and so on, and they have the plans in their mind. Already picked up the stallion 3 years ago, and then it turns out that he's not available, or this is not a good stallion for his mare. And so this is can be sometimes problematic to get more logical in what we can do, and less emotional in choosing the stallion. But in general, I'm the godmother of a lot of foals, And it's always, I'm so proud of them, and they're calling me, hey, your foal just got a prize, and so on. And it's something just great to have
That's
this
really
kind of
incredible.
relationship with them.
I think it also just builds trust if they can trust you to make a good decision for them, and the decision does come out, and with an 82% success rate, it just lends credibility to the entire relationship, I'm sure.
Yeah, for sure. After some seasons, it's easier. You know the mares very good. You know what fits them most, what they need. So it's really
I
nice.
think it's interesting with the difference between stallions and mares, where obviously stallions in one season, you've probably got a graph of 200, possibly progeny, to grade them on and to see what they're producing. Whereas with mares, historically, you've had one a year. And now, but I mean, OPXE will change that completely. You can take your top mare, put her to a variety of stallions, and see what she produces.
Exactly. This is a really nice thing you can do.
And finally, Anna, what advice do you have for aspiring veterinarians or breeders who want to specialize in horse breeding?
I think the only advice is to put your heart into it, and then it will work. Just do it with passion, and it will be satisfaction at the end, I believe.
Do you have any key lessons that you've learned in your career that you would like to share?
I think that what I would change, I would start earlier to get some experience. So not waiting till the end of the studies, just not thinking that, oh, after first year I will be doing embryo transfer and so on, but just be close to the breeders, be close to the vets, just looking around what's happening, and to get this practical knowledge, because it's easier to study afterwards theoretical things if you know how it works already. So this is a thing, not just that I have to do experiments after first year of my studies, but to get to know how the real breeder work look like.
I think with horses, it's just constantly experience with any element of it, right? Anna, thank you so much for your time tonight. We're really looking forward to seeing you in South Africa.
Yeah, hope see you soon.
Yes. So definitely in Midrand this weekend on the 19th and the 20th, and we'll be in Stellenbosch at the Stellenbosch University. And next weekend, the 26th and 27th in Midrand at the South African Equestrian Federation Training Center. Lovely setup there. They are still taking bookings for both. If anybody would like to make a booking, please email Frederica Koop. But I would not recommend using Frederica's name. It's very difficult to spell. Rather email info@proseriesevents.com, or you can book straight on the website, and that is proseriesevents.com/pro-breed. So anyone who's interested in hearing what else our veterinary expert, Dr. Anna Grabowska, has to say about embryo transfers, the freezing process, and other equine veterinary reproduction specialities, this is your opportunity to gain some incredible insights. Thank you so much for joining us tonight on the South African Equestrian Federation podcast from the horse's mouth. We'll be back again next Wednesday.